Female sexual dysfunction is another problem that we deal with on a regular basis. Probably the most difficult aspect of urogynecology or pelvic floor disorders is evaluating a woman who has a perceived problem with female sexuality or enjoyment with intimacy and intercourse. There can be a variety of different things that are playing into the problem. For example, a woman may all of a sudden feel like she's lost her libido and is no longer feeling like she wants to be intimate or have relationships. There can be a local problem that occurs that results in pain in the vaginal canal or somewhere else in the genital tract. When we see a woman who has these problems, we have to go to great lengths to really try and understand how it's impacting her quality of life. Many times that can involve bringing her husband or her partner into the discussion and sort of understanding what their perceptions are and differentiating reality from an inappropriate perception. We spend a lot of time in these settings trying to get to the bottom of what we're trying to accomplish. And again, that really involves understanding the quality of life impact it's having on the patient, on the relationship, and on her health in general. It's difficult to come up with a specific number or percentage of women that actually suffer from female sexual dysfunction. Some studies have shown as many as 98% of women, when asked a variety of questions about sex and intimacy and libido, have a perceived problem. Most women perceive that things could be better, that things maybe aren't as normal or as appropriate as they should be. So it's very important to, again, understand what a patient is experiencing and then help her realize what is realistic and hopefully work together at achieving that realistic goal. The treatment for female sexual dysfunction is specific to obviously what the woman is having problems with. The treatment can involve nothing more than therapy and helping her and her partner understand some of the things that they could be doing that are maybe contributing to the problem or not doing that could be helpful to helping the problem. If it's an actual anatomic problem, if she's got some scar tissue or some complication from a previous surgery that's causing pain or the inability to appropriately have vaginal intercourse, that certainly is addressed in a whole different fashion. As a woman ages and she loses her hormones, many times there's a drying of the vaginal skin, and there's therapies with hormones and lasers and other things that we can utilize in that setting. So again, therapy is specifically directed to the specific patient and her specific problem. Having a clear understanding of the all-inclusive pelvic floor issues is extremely helpful in managing these patients.